welcome back to my YouTube channel, and today we are going to talk about diabetic mellitus. Diabetic mellitus, this is the metabolic disorder caused by body's inability to utilize and produce insulin effectively, and therefore it can be characterized as blood sugar. Diabetic mellitus has two types. We have type 1 and type 2, and we are going to start with the type 1. Here in type 1, it accounts for 10%, and it normally occurs in children and adults up to 40 years. Here, insulin is insufficient or no insulin at all produced by the pancreas, and so patient's body needs insulin and full balanced diet to respond to drugs. And also in this stage, patient can develop diabetic coma, and that is as a result of developing infection or when a patient neglects herself or herself. Type 1 has causes, and as we start with causes, cause 1, we have viral infection, e.g. mumps. These are illness caused by virus, and they normally affect the glands, that is salivary glands, making the glands to become swollen, and they bring too much pain in the glands. Number 2, we have disease in pancreas. When pancreas is infected or have any disease, automatically it will not produce insulin, and body needs insulin to respond to drugs. Then we are going to talk about, that is all about part 1, and now we are going to talk about part 2. Welcome back to type 2 of diabetic mellitus. Here in type 2, it accounts for 90 to 92%, and it normally affects middle age and adult people, and here insulin is needed, and it is due to decreased production of insulin when cells are insensitive to insulin, and or when there is a lot of insulin circulation in the body, and it is unusual a patient may grow in diabetic. When we come to causes, we have cause number 1, we have inheritance or genetics. Here, a person may inherit it from family member who grew in diabetes. Number 2, we have obesity. Obesity is overweight. When a person gains more weight, it will affect insulin resistance. Since insulin helps body to respond to drugs, it will affect the body, and the person will not respond to drugs. Then we have number 3, we have stress. Stress stimulates release of various hormones in the body. Hence, it will lead to elevating blood glucose level. And then lastly, we have lack of exercise. A patient needs exercise to utilize or to neutralize blood glucose. It will help the person not blood sugar to rise, and we are going to part 3 of it. We will talk about management, signs of type 1 and type 2, how you can manage them, and how you can monitor them, how you can know your blood sugar level, and what you need to do. Don't forget to like, subscribe, and share. Stay tuned, part 3 is coming. Thank you.